Rich in carotenoids, vitamin C, vitamin K, folic acid, iron, and calcium. Spinach is a highly nutritious vegetable. Consuming spinach on a daily basis may help maintain healthy blood pressure, reduce inflammation in the body, prevent many forms of cancer, and improve eye health. However, it's also critical to be aware of certain health issues for which spinach may not be a good choice. Let's examine them and find out how you may safely consume spinach if any of those circumstances apply to you. First on our list, let's talk about kidney stones. A cup of boiled spinach has 120-130 mg of calcium and up to 755 mg of oxalates. One of the most frequent types of kidney stones, calcium oxalate stones, might be more likely to develop if there are high levels of both oxalates and calcium in the urine. A twist exists, though. Oxalates found in spinach have the ability to bond with calcium in meals in the intestines. In such case, this combination creates an insoluble substance known as calcium oxalate, which instead of entering the circulation is eliminated in the feces. And it seems to be the key to avoiding kidney stones when consuming foods high in oxalate, like spinach. If you choose, you can get additional calcium from dairy or plant-based milk when consuming oxalate-containing foods. However, persons who already have CKD or renal failure, or who have a history of kidney stones, should still use caution while consuming spinach. Steer clear of spinach entirely, or consume it in moderation if your healthcare provider permits it. There exist several methods for decreasing the oxalate content of spinach and minimizing the likelihood of kidney stones. Follow us through to the very end to find out. Number 2, gut disease. You might want to reconsider how much spinach you eat if you have any gut problems like SIBO, leaky gut, intestinal dysbiosis, or inflammation. However, why? In fact, certain beneficial gut flora may consume oxalates to stop them from entering the circulation. On the other side, the balance between good and harmful bacteria is severely upset if you use antibiotics frequently, don't take enough prebiotics, drink excessive amounts of alcohol, or eat and drink too many sugary foods and beverages. Following that, you may begin to experience common digestive problems, including diarrhea, bloating, gas, and constipation. At that point, your bloodstream may absorb more oxalates than they are expelled from your stomach in the form of stools. Additionally, having IBS or IBD may increase your risk of kidney stone, since the inflammation associated with these disorders might interfere with your body's ability to absorb certain substances. This causes malabsorption, which occasionally leads to the development of kidney stones. Research indicates that individuals with leaky gut, intestinal dysbiosis, or inflammation have a higher rate of oxalate absorption, which can reach up to 40–50%, hence raising their risk of kidney stones. So, if you are more prone to kidney stones or have other digestive health issues, you might want to avoid spinach. Number 3, gout or joint pain. When urate crystals accumulate in your joints, it can lead to gout, which is essentially an inflammation type of arthritis. This results in gout attacks, sometimes referred to as flare-ups, which are episodes of severe joint pain and inflammation. The formation of urate crystals is typically associated with elevated blood uric acid levels. When your body breaks down old or dead cells, or when you ingest foods high in purines, such as organ meats, seafood, legumes, and some leafy greens like spinach, it produces uric acid as a byproduct. For every 100 grams, cooked spinach has around 30 mg of purines. Gout sufferers should not consume more than 120 mg of purines daily, according to experts. Although the number of purines in spinach is under that limit, it's still important to consider it because you might already be getting purines from other daily foods. So, if you want to prevent gout flare-ups or lower uric acid levels in your body, it's best to avoid spinach or minimize its intake. Number 4, thyroid problems. A disease known as hyperthyroidism occurs when the body produces excessive amounts of thyroid hormone. Your thyroid gland enlarges or becomes hyperactive when you have hyperthyroidism, which causes it to produce extra thyroid hormone. Thyroid hormones normally aid in the production of energy, regulation of body temperature, growth and development, and even the health of your heart, brain, and intestines. However, an excess of these hormones produced by your thyroid gland quickens your body's metabolism. In addition to many other symptoms, it might cause weight loss, hand tremors, anxiety, sweating, vision issues, irregular heartbeats, and more. Goitrogens are abundant in cruciferous vegetables, such as broccoli, spinach, and cauliflower. Goitrogens may obstruct the thyroid gland's ability to absorb iodine. This impact could be more noticeable in patients who have goiter, hypothyroidism, or an iodine deficit. However, spinach might not be all that awful for hyperthyroidism sufferers, since hyperthyroidism increases the risk of osteoporosis and other bone diseases. The calcium found in spinach may actually benefit those who have an overactive thyroid. The calcium content of spinach may not be sufficient, therefore, they must make sure they obtain enough calcium from their diet or supplements. Number 5. Chronic kidney disease. Your kidneys may not be able to filter toxins and extra fluid from your blood as effectively as they once could if you have chronic renal disease. Your body may experience an accumulation of waste products, minerals, electrolytes, and fluids as a result. People with renal illness are frequently at risk for excessive potassium levels in their blood, partly because their kidneys are unable to eliminate the additional potassium. Because excess potassium alters the function of the heart's muscles, it can be quite harmful. Elevated potassium levels can lead to abnormal heartbeats or arrhythmias, which can raise the risk of a heart attack. Like many other leafy green vegetables, spinach has a high potassium content. At least 839 meg of potassium may be found in 1 cup of cooked or boiled spinach. Although those with renal disease should typically limit their daily potassium consumption to less than 2,000 mg. This implies that you will receive over 50% of the recommended daily intake in a single meal, which may raise your potassium levels even if you consume other low potassium items throughout the day. Spinach may be made less potassium-rich by soaking it in cold water for at least 2 hours, boiling it for 10 to 15 minutes, and then draining the water. To extract even more potassium, you may boil it for a further 5 to 10 minutes in new water. This way, you can lower its potassium content by as much as 60%, making it much safer to eat. Number 6. Blood clotting disorders. Your blood vessel disease risk factors include high levels of inflammation throughout the body, heart disease, diabetes, renal illness, and some hereditary diseases. On the other hand, excessive clotting can harm your liver, kidneys, lungs, and other important organs in addition to raising your risk of heart attack and stroke. Anticoagulants and blood thinners are frequently used to treat blood coagulation issues. These drugs usually make it harder for your blood to clot. Like certain other leafy greens, like broccoli and Brussels sprouts, spinach is high in vitamin K. This vitamin K can interact with blood thinners like warfarin or aspirin. Your healthcare expert might even ask you to stop eating spinach if you're taking warfarin. If not, ask them how much spinach you can eat daily while taking your medications. Let us know in the comments if you want us to talk more about any of the conditions in this video. Thank you so much for watching. If you want to see more videos like this, hit the like button and subscribe to our channel.